4 years ago, law enforcement officers launched a program to address the flow of drugs into East Tennessee that was fueling the drug epidemic, the opioid epidemic. So the question is, has the 313 initiative achieved what it was created to do? Digging into this story is 10 News reporter Olivia Dague. This is a story we'll see later today on 10 News, but you're joining us now to tell us more about what you learned as you were covering this story and talking to the people. But I think we need to start out. Number one, give us more detail as to the 313 initiative.
Yeah, absolutely. So 313 is the Detroit area code. And East Tennessee is such a interesting place for law enforcement, they described, because of these major corridors. We have 75 and we have 40. And 75 specifically runs from Detroit to Cincinnati, Lexington, to Knoxville, Atlanta, and Tampa. And all of these agencies are seeing such a increase of drugs in that area because it's basically a pipeline, this major highway network. And so while they were trying to discover how to tackle the opioid crisis, when they started this in 2022, overdoses were at an all-time high. Like 500 people died in Knox County.
We were doing stories constantly on this ever-growing number.
But now it's starting to come back down. And law enforcement say this is part of the puzzle, is getting more drugs off the street. But 313, basically, all of these major cities along this corridor, all of these counties and jurisdictions, they're all working together to target these criminals. And they have arrested around 500 people related to this initiative since they started it in 2022.
So let's dig into, yes, the results they have seen thus far. They have arrested a lot of people. Drug overdoses, what are they seeing there? Because once again, as we just were mentioning, it had been such a constant story we were reporting on, the tragic deaths.
And it is so tragic because we also have to remember that these are numbers, but they're also people, they're families. And so the ripple effect of this is immense because it's affecting families. And for as many drug overdoses, there's also people that are living in active addiction. So these numbers just give us one small piece of the puzzle to this larger crisis. But in the last year, I think 2025, the numbers that I got from District Attorney Sharm Allen here in Knox County, 272 deaths, which is nearly half of what it was when they first started this program. Now, this is one piece of the puzzle. I don't want to speculate that this is the sole reason for less deaths, and neither do Knoxville Police or Knox County Sheriff's Office, but they do contribute, this initiative, getting these drugs off the streets, to be part of the solution to this.
Not only getting drugs off the streets, but what you shared with me in your notes, hundreds of weapons off the streets as well.
Well, we talked about that both with Knoxville Police and the District Attorney's Office. Is these drug traffickers, unfortunately, are also bringing violent crime with them in a lot of cases. They are bringing lots and lots of valuable product, you know, in the scheme of thousands and sometimes even millions of dollars worth of drugs. So they're protecting it with guns, sometimes illegal weapons. I actually learned from KPD that there are lots of gun manufacturers here in the East Tennessee and Appalachia region that are bringing guns back up to Cincinnati and Detroit as these drugs are coming back down. So the pipeline is going both ways, both north and south of this corridor.
And when we talk about initiative, this is law enforcement from the north all the way down to Florida, including Tennessee, tackling this. Would you say, based on the people who you spoke with, would they call this, at this juncture, a success?
Absolutely. Yeah, they are very proud of the success that they've done, and it is really about collaboration. If all of these agencies were working in a vacuum, this would not be as successful as it is, because they have, if you think about the resources between all of these major cities, between all of them, and Sharm Allen even said it, East Tennessee is a very unique place because of the collaboration and the support for law enforcement in this area. So a lot of people are getting caught here in the Knoxville area. And also she credits the surrounding counties as well, and the Tennessee Bureau of Investigation, who really kind of headed this effort to really target and tackle this, because it's not just about drugs, it's about lives, it's about addiction, it's about violent crime, that all of these they're trying to reduce.
You spoke with District Attorney General Sharm Allen and a member of the Knoxville Police Department. Sharm Allen has been a part of the Attorney's office for many, many years. She has seen just the flow of drugs from not just our recent past, but decades ago. She can kind of explain how it's ebbed and flowed and what has risen in popularity and what has replaced it, right?
Yeah, absolutely. And she really is looking at the big picture of this, but I also spoke with a Knoxville police officer. He's actually a lieutenant, excuse me. His name is Josh Schaefer, and he's been with the department since '98, and he kind of talked about this on a more street level of what they've been seeing. They started seeing a lot of activity, people that they were arresting and people that they were seeing activity from. They would pull them over. They would see that 313 area code. They were like, man, all of this stuff is coming from Detroit. I've learned through him that lots of drugs were being prescribed. So it started out, he was seeing just kind of this shift of the popularity of drugs. He says in the early 2000s, crack cocaine was incredibly popular. But then in the mid-2000s, we start to see the rise of opioids, Oxycontins, those types of things. Lots of pills coming in from Michigan. There was a demand not only in East Tennessee and Appalachia, but if you look at this pipeline, Atlanta and Tampa as well, then it turns into heroin over in 2012 is what he says. And then now what we're seeing is fentanyl and other synthetics of fentanyl. So really it's an evolution, but it's also that same type of high that addicts and users are looking for. And sometimes it's in cheaper and often more dangerous forms that we're starting to see. And that's also part of these drug overdose numbers increasing.
Yeah, cheaper, easier to get. You see how just the circle continues. When we before we started talking on air, you shared that this officer has story after story after story that really paints a picture of the desperate situation it was at a certain point. If you can share one or two of those stories.
Yeah, so he has a really unique perspective because we're talking about it at this macro level, right? You see this giant map that spans so many states, but he's looking at it kind of in Knoxville. I learned this too. They start investigating who dealers are. Sometimes the scene of the crime starts at an overdose. They try and trace it back to who sold the person these drugs. And he shared that there was one story of a gentleman who was distributing drugs. He himself had been a user and then became part of this drug trafficking scheme to fund his own habit. And there was at one point where he was selling a lot of pills and he was told by someone else in the organization who was higher up, he said, call all of your friends and your customers who are pill users and invite them over to the house. They were giving out free samples of heroin and trying to get people addicted to heroin, because he also explains that these other drugs like heroin and fentanyl, they are cheaper for these drug traffickers as a business to try and get them down the pipeline to sell them. They're cheaper than some of these more prescription pills, which used to be very popular. And those are still popular.
Sure.
But another trend that he's seen, it's also important to mention that they're not seeing necessarily a decrease in criminal activity. They're seeing around the same amount of arrests. They're picking up more people or around the same amount of people with higher quantities of drugs. He said it used to be that they would pull people over with ounces, and now they're seeing kilos.
That's disturbing.
It is.
It is disturbing. But yet, you say, based on what they have seen up to this point, since it launched in 2022, they see it as a success. What is the future? Did they delve into what the future of this program? Will it continue?
I think with all law enforcement, we're seeing how technology is really playing a role, and they didn't get into specifics of that, but they did want to make it very clear that this is a target. They said that they felt like there were some narratives at some point in time that Knoxville would be an easy place for people to get off and people to just continue down the pipeline. And they want to make that message very clear that they are targeting people that are coming from Detroit specifically, that are trying to bring drugs down here. And they're using all sorts of technology. They're tracking people, pinpointing people, trying to really target this problem.
I want to talk about you as a reporter in tackling this story. Walk us through the process of how you reached out to these individuals to get the information, and then you're pulling it all together in order to have this story tonight that will share this information with our viewers.
So it helps that I've been here for almost 3 years now, because we build off of what our colleagues before us did. And Grace King was an investigative reporter here, and she's now joined our sister station in Atlanta, 11 Alive. But she really was tackling this story. She even created this map that we're looking at. But really, what we're seeing is the continuation of following up on stories that we're covering, because it's important and we have data to back it up. But also, what really triggered this was, I've seen a couple of Facebook posts from Knox County Sheriff's Office who are seizing large amount of drugs, and they are tying it to the 313 initiative. These people are coming from Detroit and Michigan. And it's a question that we ask in our newsroom whenever we're seeing these drug busters, like, where are these people from? Because sometimes when people are arrested, we get information about where they're coming from. A lot of times it's from Michigan, it's from Detroit. Mm-hmm. And so we then can't assume, but we need to ask those questions.
No doubt. And when you went to the district attorney, Sharm Allen, and reached out to KPD, were they eager to talk about this, to share the success?
They were. They did really want to talk about this program because it is so, it has been so successful for them. And they really do want to shine the light on just the collaboration from all of these different law enforcement agencies who are really working together to solve this problem. And they also talk about education. Education's a big piece of this. You mentioned that Narcan could also be a big piece in this as well.
Yes, and the reduction of ODs that we're seeing.
Right. There's so many pieces. There's a mental health aspect of this. And so it's also important to remember that these agencies are working with Metro Drug Coalition and the McNabb Center, even state lawmakers, to get funding for these different types of things. It's an ongoing conversation because it's tied to so many other things.
It's the allergies. We're blaming it on the allergies. I'm right there with you, my friend. And that's the thing as a reporter. It's satisfying, if you will, when you can continue to follow a story.
Yes.
And it's never ending. Mm-mm. Because one story leads to another, mm-hmm. But you are able to bring people up to date because people need to know where things stand. Mm-hmm. And I think you've done a wonderful job in bringing us up to date on the 313 initiative. We'll be looking for your story later today on 10 News at 5 and 6. Olivia, as always, thank you for your time. We appreciate you.